To improve care pathways is, of course, the essential today to try to do this, and finding ways to do it in a university hospital, cooperating with primary care, other hospitals also, is very much of trying to make settings for actually team-based work. When we're talking about value-based care and establishing value-based healthcare, I think most of all it's for the organization to really focus on how can we enable to empower the improvement teams, because if you can find a structured way of letting these teams get together, empower them with good data, IT systems that will deliver the data in an easy way, so that they actually have the possibility to work differently, that they can really focus on how to improve the care pathway without having to bother about all these difficulties organizational-wise or data-wise, because it's difficult to get access to good data. It's difficult to organize it. But if you do that and create these settings in a better way, the teams, you can really rely on these interprofessional teams. They know what they're doing, and when they're engaging the patient, many things will happen, good things for improving healthcare. And the other part that has been very important is, of course, how we engage patients in these kind of practical work, so that they're actually participating. Patient representatives are participating in the work in all these meetings, because that makes, of course, a different kind of focus than we have had before. It becomes even more evident that it is for patients, and patient challenges and problems are very obvious in this kind of setting. What often happens when you get people together is, of course, that you get the focus on patient issues. So in this setting, our patient representative, really emphasized the importance of measuring outcome, telling now, like in the patient organization, that we really know how are the results of our operation, how many patients are getting impotent or incontinent. And how can we improve this, which really makes a difference, of course, for these patients. Previously, we didn't have outcome measures. So we thought we were doing really good things if we could, add a new operation, one more operation because then we thought it will be better availability. But as we didn't have outcomes, we didn't know if this patient got to be more impotent or incontinent because of our treatment. So what they discovered was that when you really look at outcome, actually those who had best results, they were more thorough in their operation. So it took half an hour more. So actually the right thing was to say that it should take a little more time. Let's educate everybody to operate like this. Then we see that the frequency of impotence and incontinence is lowering. At that time, then you can start trying again to make it more efficient, when you know that still the important aspects of incontinence and impotence is not affected by the way you want to make it more efficient to allow more patients to be treated. The big problem and challenge is actually the data part. It's difficult to access data today, even in Sweden, where we have 108 national quality registrars, so very many of them really high quality, but they are still, you have to log into different systems to get access. And sometimes it's too difficult for these teams to get adequate data, good quality data, so they can act, accordingly to data they can rely on. So maybe, you can have an organization that get all these stakeholders together to get this kind of more global view of how we should be able to cooperate and have these new areas of meeting points, not only in healthcare, but also between healthcare and those providing technical solutions, standardization, etc.